welcome to the Circle webinar series with this month's topic, Rise Through Fall. We greatly appreciate you taking the time to be here today. Before continuing, we want to acknowledge that we are hosting today's session from the traditional territories of the Blackfoot Confederacy, the Tsuut'ina and the Exactly Nakota nations, and are honored to have team members and attendees joining from other territories across North America. So again, welcome. My name is Michael Reines, and I'm fortunate enough to be the Director of Sales amongst the great team here at Thrive Health. Please note that this session is being recorded and live streamed on LinkedIn today, and the recording will be available online afterwards. Without further ado, I'm excited to introduce our co-host today, Dr. Sapna Sriram, a healthcare entrepreneur who brings 15 years of experience in the medical, health, and wellness industry to her role as founder and CEO of Integra Health. Dr. Sapna is a dedicated clinical and business educator to clinic owners and clinicians all across Canada. Dr. Sapna is passionate about building patient experience-focused healthcare systems and believes that collaborative and integrative health models that embed digital solutions, transformative processes, and outstanding communication are vital to bridging gaps in healthcare. Thank you for joining us today, Dr. Sapna, and I'll pass it over to you to introduce our guest speaker.
Thank you so much, Michael. Good morning, everyone. I am so excited to be here alongside, of course, yourself, Michael. I'm also very excited to be here alongside Rebecca Miller. So I wanted to do a little introduction to Rebecca before she starts her presentation. So I'm going to go ahead and give you a little bit of background on Rebecca. Rebecca is a registered social worker with more than a decade of experience providing mental health services to both families and various organizations. She brings a variety of counseling modalities into her practice, ranging from CBT, DBT, EFT, and positive parenting, and more. A lot of the areas of specialization that she focuses on, both in our practice and beyond, include both families and couples therapy, psychiatric disorders, and child and adolescent behaviors. And she works with her clients to really focus on finding solutions and strategies that work best for them. And she recognizes that each patient's journey is different and requires a custom plan of care that meets their unique needs. And what we're most excited about is Rebecca is going to be speaking to us today around rising through the fall and coping with, various mental health challenges that we might be facing as we enter into this new season ahead of us with, again, a lot of change, things that, the kitschy words that we're used to during COVID, unprecedented times, change and things that we need to, learn to adapt and readapt to. So I'm very excited to also be here for her talk. I will be moderating along the way. And quickly, before I pass on the mic to Rebecca, we are moderating for questions as well. So if you would like, you can leave any questions you might have both in the Q&A as well as in the chat box. And we'll make sure that we have time today at the end of her presentation to go over any questions that you might have. So without further ado, the stage is yours, Rebecca. Thank you.
Thank you, Sapna. That was such a nice introduction. Hi, everyone. My name's Rebecca. I am actually up in Ojibwe territory, which is part of the Robinson-Huron Treaty, better known to many of you, or maybe actually not known at all, as Sault Ste. Marie. So we're actually right on the border of the Canadian-American border, right at Sault, Michigan. So for the last few years, I've been providing clinical supervision to a team of clinicians, and I'm an EAP provider myself. And so today I'm just going to take about 15 to 20 minutes to talk about what we as clinicians are seeing and hearing from people about going back to work. I'd like to talk a little bit about what people are experiencing and the challenges that have kind of presented themselves as a result of our current climate. I'm going to also give you a few strategies to try to address these issues. A little validation can go a long way to rebuilding your relationships with your peers and your coworkers, as well as your employees and even your own work satisfaction. And then I'd just like to take a couple minutes to talk about how EAP can help. I hear a lot of people saying, I don't know if EAP could help me. I really don't know why going to a counselor to go back to work would be helpful. So I'd like just to take a few minutes at the end to chat about that. So what we're all really experiencing right now, there's kind of 5 big ones that we're all kind of experiencing. This is ourselves, our coworkers are going through this, our employees, and even our employers are experiencing these things. And the number one is anxiety. So many of you are probably already familiar with that fight or flight response, or maybe you've at least heard the expression fight or flight. And what it really is the amygdala, which is that fear center of your brain, is triggered when you find a situation threatening, and it prepares your body to either fight it or to run from it. However, that's a very sort of acute response to a very immediate threat. There's also a lot of long-term symptoms of anxiety and depression that people don't always recognize right away. And we call them sticky cats. So it's your inability to fall asleep. And this is a big one that we're hearing from a lot of people, or interrupted sleep. So maybe people are able to initiate sleep, but they have a hard time staying asleep, or they wake up and they're having a lot of ruminating thoughts. It's a lack of interest is a symptom of anxiety, are not really getting the same joy out of things that you were getting before, or inability to sort of stay in the moment and enjoy things because your thoughts are racing about all of these other things that are going on. We're seeing people report a lot of feelings of guilt, feeling guilty about not being as productive at work anymore, guilty about having to leave their kids, having to leave their family. Generally, a lot of ruminating thoughts about a lot of guilt, lack of energy. So we're having to get up earlier, get to the office earlier, set some boundaries. These things take a toll on us mentally and physically. So people are feeling extra drained now at the end of the day. We're also hearing people talk about a lack of concentration. So again, those ruminating thoughts are coming in. They're feeling like they're not as productive, and they're just having a hard time concentrating and getting through the day. Loss of appetite or increased appetite. People are also having psychomotor functioning. And at the very extreme, people are also having some suicidal thoughts. So all of these things are symptoms of anxiety and depression that people don't always recognize every day. These are the number one things that people are reporting to us right now. The number two, sort of 2 and 3, are feeling of loss of control, and it's coupled with issues with time management. So people have been flexing their time. They were feeling very productive, working many, many hours into the evening. They were putting time in on their own time, managing daycare requirements, before and after school, transportation, grocery shopping, home projects. We had all these things that we were sort of juggling really well for the last couple of years. And now we have to get back into this regular 8:30 to 4:30, which means setting boundaries. It also means finding before and after school care, managing transportation in a different way. We also have less access to work and our work computers. Some of us have had to hand in our work computers, and now there are desktop computers. So we have to have our work finished by 5 p.m. and we're not coming back to it until the next day. We're not able to see that work again. So again, feeling less productive, feeling like we're going to miss deadlines, which again produces some more anxiety because we're worrying about those work deadlines in the evening. It also affects our ability to manage money. So number 4 is struggling with the increased cost of living. Inflation has sort of affected us all. And now there's this added cost when we go back to work of gas, maybe train tickets, buying lunches and coffees. We might have to be paying again for daycare or before and after school program. So on top of the cost of inflation, which is again has hit us all, we're all experiencing these additional costs right out sort of one lump sum, which produces a lot of anxiety and that ongoing threatening feeling of doom. So rounding out our top sort of 5 issues that people are presenting to us about going back to work right now is grief. We've all experienced a tremendous amount of grief in the last couple of years. We've experienced losses of friendships and romantic relationships. We've all experienced maybe a death of a loved one or know someone who's experienced a death of a loved one in a world where the way that we grieve is not the same. Funerals had been moved to private or they weren't held at all. And this was a common grieving tool that culturally we all kind of had accustomed to. We all had a funeral, a ceremony, a goodbye sort of option when we were grieving that was kind of taken away from us. So the way that we grieve has changed. we're also grieving, losing that time at home. So we all regained some extra time with our immediate families, our parents, our children, and dropping them off from school, picking them up from school at the end of the day. And through that, we've all been really made hyper aware of how precious our time with each other is. And now we're being asked to give more of it away, right? So we're really, really grieving. We're grieving our way of life as well. So the world has changed tremendously in the last couple of years. Our beliefs and attitudes as a society have changed, and our relationships have been challenged. Our entire ways of knowing and understanding and seeing the world have been challenged within ourselves, and we've challenged each other. Certainly, online and relationships have been challenged because of that. So we have all of these different ways that we're grieving. If you might remember, or if you've ever done any sort of grief training, the symptoms of grief are depression, anger, denial, bargaining, and acceptance. And we don't go through them, in order. We don't, finish depression and then move on to anger, and then finish that and move on to the next one, and it's done with. We weave in and out of those different areas. So if you can imagine, we're all going back to work in an environment where literally everyone is grieving, and everyone is in one of these stages of grief at one time or another. So these big issues of grief, loss of control, the inability to feel like you're managing your time effectively, the inflation and anxiety have really created this sort of perfect storm, to potentially see a lot of workplace conflict with this upcoming sort of mass return to work, right? So there's a lot of potential challenges for employees, and employers when we go back to work. Some of the problems that it can create, are this increased affect. So I talked earlier about that sticky caps, right? Sleep, interest, guilt, concentration, appetite, psychomotor, and suicidal ideation. These are things that we typically assess everyone for when they come through our door during a first assessment, an initial assessment, to try to grab a baseline. And people are coming in generally with much lower numbers. So we would often use like a scaling question. I might ask somebody, on a scale of 1 to 10, how are you sleeping? And generally those numbers are really low. They're a 3 out of 10, they're a 4 out of 10. Concentration is really low. It's a 3 out of 10, it's a 4 out of 10. So we're seeing a really increased affect in lower moods, higher anxiety. We're also seeing lower work satisfaction. So people are saying, I just don't know if this is really the job for me anymore. Or they're saying, I'm feeling really unheard by my employer or unvalued. I've been putting in all of this work and I was really flexible for the last 2 years. And now I have to go back to this really strict model, and it doesn't really seem fair. We're also seeing people talking about a poor work-life balance. So it's interesting because when people would come in to see us during the pandemic, they would talk about this work. We would ask about work-life balance, and people were putting in extra hours, right? People were putting in 3 hours additional a night than they were used to putting in, but we're still feeling like they have this good work-life balance because they're working from home. They can get a cup of coffee when they need to. They can get a snack when they need to, get outside and get the mail, go for a walk. And now that they're back to work, 8:30 to 4:30, for people who have already gone back, they're saying that they have not been able to get back into that flow easily. So they're coming home from work, they're feeling exhausted, they're feeling anxious, and it's really difficult to try to engage in activities that they feel like they should be doing, whether it's cleaning their houses or maybe spending time with loved ones. It's really hard to do anything other than just get through that work day right now. Because of the cost of living, one of the other challenges that we're seeing is a lack of housing. So people have had to move. There has been a number of rental units that are going in our area anyways. Rental units are all being sold into private dwellings. So people are losing their housing at mass rates. There's a lack of transportation, the cost of secondhand vehicles has really, really skyrocketed. So people are having a hard time finding reliable transportation, reliable housing. There's a lack of childcare. There's a lack of childcare providers right now, and all the daycare spots are filled up. So with this return to work, all of these places that were empty, like childcare centers that were empty for a long time, have now gotten wait lists that are, 2 years long in some places. And again, with housing, we're seeing people on the housing list for affordable housing or sustainable housing is 2 to 3 years long in some areas. So people are really, really struggling with housing, transportation, and childcare. And we're seeing a lot of conflict. So worker to worker conflict, really a lot of conflict with peers. People have been working on their own part of it for the last 2 years. So they haven't had to really be answerable to anyone but themselves and their deadlines. And now they're surrounded with coworkers. They're also surrounded with other people's beliefs and other people's trauma and other people's grief and other people's anxiety. So within these buildings now, we sort of have these clusters of emotions, and is causing a lot of conflict with peers. So we're seeing the number of HR complaints go up, the number of complaints about aggression, really, really sort of skyrocket for employees. We're seeing a lot of avoidance as well. So that's part and parcel with having a lot of anxiety, is that we tend to avoid things that cause that affect. But with work, we're seeing a lot of missed work. So people are coming back to work and using up their sick days almost immediately, using up their personal days almost immediately, a lot of lates to work. And actually a lot of apathy around that. So that's that idea, like, I'm late and I don't care. That's too bad for them. It was okay for me to work 3 hours in the evening, but now it's not okay that I'm 10 minutes late. Or I missed that deadline and I don't even care, right? A lot of apathy about work and getting work done. And then we're just seeing, again, a lot of avoidance or ghosting. So people aren't answering their emails. They're not returning phone calls. They're not returning messages to clients, to peers. They're just really avoiding that work while they're in the building. And then that contributes to that feeling of not being productive at the end of the day as well. So we have sort of a number of issues, these top 5 issues, and all these sort of problems that it created. It's just a really big storm. The good thing is that nobody really knows, no one's an expert in how to deal with this right now. And just a very little bit of validation goes a long way. So all of our experiences, even though we're all kind of experiencing the same thing, all of our experiences are pretty unique. So we want to just sort of spend the time with each other, spend a few minutes, try to understand what their experience has been, and validate that person's experience. And we can do that by we say, acknowledging the elephant in the room, right? So if you're both thinking it, just say it and acknowledge it. If your commute is almost 2 hours and it actually was better working from home, then just acknowledge that. Not every company has the means and the staffing to convert from a work home environment to a long-term work from home environment, to make that permanent, right? And maybe that's your company's situation or your organization's situation. So just try to acknowledge it. Don't try to pretend that it's better if it isn't. You want to really try to identify what unique needs have arisen from these people's experiences. And you can just do this by asking. So don't try to assume that because someone has children, for example, that daycare is their biggest issue, right? Ask them, find out what their needs are, and then just problem solve with them ways to meet those needs. And this can just be as easy as, I can imagine how frustrating it is for you to have to come back to work after you've been managing your time very well and been very productive for the last 2 years. I see that your productivity level has been up and that you're flexing your time has actually been better for you. What is it that you need to be able to come back to work? What can I help you do? What can I help? How can we problem solve this together? So it's really just about validating and acknowledging their experience and problem solving it with them. So how can EAP help? So we've noticed that EAP is largely underutilized. EAP is often used by parents for their children. You know, my kiddo's experiencing some anxiety about going back to school, or we're going through a divorce, so they'll use up their EAP for their children. We see very few managers that are coming in for EAP, and often people are only using their EAP when they're off work, and it's part of their workers' comp or their back to work plan is to use this counseling. So people aren't really using it as a preventative strategy, but there's a lot of ways that counseling can help. So it can actually help you understand yourself better. It can help you understand your coworkers better. It can help you be a better worker. It can help you be a better peer, you know? So we have CBT strategies. So CBT is cognitive behavioral therapy, and cognitive therapy identifies the ways that our own belief systems, how I see and view the world, informs my thoughts and my behaviors and action, right? So if I've created these specific rules for myself about the way that the world works and about the way the work world works, anything that kind of goes against that rule is going to give me a lot of anxiety, which in turn is going to create a lot of avoidance, right? So when you understand that about yourself or your staff, then it helps you sort of understand your own behaviors and actions, and it also helps to understand why people are doing that. You can also take EFFT. So this is emotion focused therapy to learn sort of your own approach to emotional distress. So this helps us as employers and employees to kind of understand our own helping approach. So what is my approach to helping others? And it says, are you a jellyfish, an ostrich, or a kangaroo? And so the jellyfish is the helper who tends to dive into the emotion with other people. Oh my goodness, this is happening to you. This is terrible, you know, and now everybody's really anxious. The ostrich is the helper who really digs their head in the sand. They don't see the emotion, they don't acknowledge it, and they don't validate it. The kangaroo, on the other hand, acknowledges it, but just doesn't really see the emotion. They just try to problem solve the issue, right? So this is the person where you say, oh, I'm having issues with childcare, and they come back to you with 20 to 30, you know, problem solving ways to deal with that. This is what you're going to do about it. Have you tried this? Have you tried that? So you'll hear the words have you tried from a kangaroo quite a bit. But again, once you understand what your helping approach is and what other people's helping approach is, it can help you to resolve those conflicts at work a lot better. DBT is dialectical behavioral therapy, and it's a lot about distress tolerance and learning to manage stress. Excuse me. So you might have heard of the 5 senses strategy. It's a common one that people use when they're feeling anxious or feeling panic. It's naming 5 things that you can see, 4 things you can hear, 3 things you can feel, 2 things that you can smell, and something you can taste. 5, 4, 3, 2, 1. And it's just a strategy to sort of ground us, bring us back into the moment, and relieve that anxiety. And we see a lot of employers and a lot of HR departments sending this strategy out a couple times throughout the day, just to remind their employees to sort of come back, ground yourself, remind yourself where you are. It also teaches sort of body scanning and different sort of mindful activities to manage stress. And then finally, counseling can help you work through those feelings of grief and loss, right? Which we're all experiencing, that anger, the denial, the depression. So, you know, in summary, counseling can make you a better coworker, it can make you a better employee, and it can certainly make you a better employer. And that's everything. Are there any questions?
That was fantastic. Thank you so much, Rebecca. We actually do. So there have been some questions coming through. So Michael, are you okay if I go ahead and just start reading out some of the questions that we got so far?
Absolutely, go ahead.
Okay, wonderful. So I'll start with our first question. So when it comes to productivity, do you feel that things need to change regarding the standard 9 to 5, 5 days a week?
Yeah, that really depends on your organization, right? Some organizations just don't have the ability to do that, and some do, right? And so, really, just communicating that with your employees is the most important part, or with your employer is the most important part. There are reasons why we do things, there are reasons why we have the setup that we do. Some things just don't fit into that, though, right? Like for the last however many years, every parent can acknowledge that we've been putting our kids in before school and after school programs because school doesn't start till 8:45 and school ends before 5 p.m., right? So we've been managing that for years, right? It's just coming back to manage it again is along with all the other things that we're going through that impair our functioning. And if you ever go to for any sort of diagnosis, that's what they look at is how is your functioning impaired? So all of our functioning is impaired right now, which is why we're having a really hard time managing the 9 to 5. So I don't know if it needs to change. It's just that people are having an extra difficult time managing it right now.
Yeah, and I chuckled a bit because I can totally resonate with the aftercare, before care pickup. And I don't know about everyone else on this chat who have school age children, but I also feel like during COVID, school seemed to have finished earlier and earlier. And and we're just like, okay, not all of us are in the situation where we can leave work early. And I do know that, that's something that as well, even just for our own family, we're quite, anxious about for this coming fall. Okay, there's another question in the chat here. So the question is, how do I know which modality? So I guess when you were talking about CBT, EFT, how do you know which modality, or how does a patient or someone attending know what type of modality they would need, and what should they look out for in a counselor or a clinic if they've chosen to go on the route of counseling?
Yeah, good question. So what happens, a lot of people get, with your EAP, you get a certain amount of sessions sometimes. Sometimes it's 6, sometimes it's 12. People spend a lot of time figuring out with their counselors during those sessions what it is they're looking for. And it's actually a lot of wasted time. So I usually suggest that people seek out free counseling first. There's a lot, you have a lot of walk-ins where they do sort of critical incident management. They do sort of like at the moment, let's give you some strategies so that you can get out the door and you can feel better in the moment, right? But throughout those, you sort of get an idea of what it is you want to work on. When you start your EAP or you start paying for counseling, because it's very expensive, you want to be able to identify your goal,
Mhm.
right? So if you're coming in and you're just sort of really working through that goal setting, you might spend your 6 sessions and still not really know what your goals are. The other thing is that there's a tremendous amount of counseling available for teens and for youth. So I would recommend that, I don't want to say waste your time, waste your sessions on your kids, but there are sessions, it's easier to access free counseling for a teen than it is for an adult. So seek out, CMHA, Canadian Mental Health Association has a walk-in. Almost every sort of organization that works with children and youth will have a walk-in available or free counseling available or a number of sessions. Some pediatricians will even offer that. Some nurse practitioners are now trained in CBT. So there's a number of ways that you can work to identify, one, what your goals are before you go into those 6 sessions with your EAP provider, and then two, get the counseling that you need for your children separate from your own insurance, if that makes sense.
Yeah, no, that's really great. And I think too, even to add to that, even in our own office, we are always looking at an intake coordinating, process that follows your goals, that, has involved your physician in the process, because a lot of that is really just identifying, making sure you've got the right counselor put in place for you that is also equipped to deal with your goals, because everyone's counseling goals are going to be different. And also too, making sure that if you're going to embark on paid therapy, that, there is free informational sessions that you can, where you can meet your counselor, talk to your counselor about those concerns, and actually really researching your counselor. I find that often at times, if you're embarking on counseling and you can't access, the counselor's bio and research what kind of modalities they do and do your own due diligence, that becomes even harder for you to start that therapy journey. And that's something too that, I always say, I always advocate on. You must know who you're getting into therapy with or any type of work with, right? So that's another big add-on that I'll sort of add to Rebecca's response. Okay, the questions are pouring in. So let's ask the next question. As an employer, how might we identify an employee that can benefit from counseling? So that's a tricky one. So I guess this is now flipping the hat on the employer side, and a manager or a director or somebody in charge. How did they recognize or identify an employee, and then also broach that conversation of how to start therapy?
Yeah, so again, like really talking to your employees, like I said, we're all sort of going through the same thing, but everyone's experience is really unique. If you're noticing the signs, again, like avoidance, dropped calls, ghosting, sorry, not dropped, but ghosting, avoiding those calls, not responding to emails, using up all their sick days immediately, right? These are all signs that somebody is not managing their return to work very well, right? There's sort of an impairment in their work, a decrease in productivity. And then it's just really from there, having that conversation and finding out where they're at, really, really listening to them and really validating what their experience is, and then asking, what is it that you need? Reminding them always of EAP. We have a lot of HR departments that will frequently just send out the information around EAP, and so they'll say, have you been avoiding, emails lately? Have you been missing a lot of work? Have you been feeling very anxious? Have you been struggling with sleep? And then a little blurb of here's how counseling can help. So, and they just send those out regularly.
Mhm. Great. Okay. In your experience, when someone is feeling less engaged at work, do they come to realize their job isn't right for them more often than not, or does it have to more do with the socioeconomic landscape around them?
Yeah, it's the latter for sure. So, if everything else is not going well, your job is not going to feel like it's going well either. It's not very often where people come in and say, my life is a disaster, but work is really great. Typically, if you're not managing well in your life, if you're not functioning well in life, work is probably one of the first things to take that hit, kind of. So it's people will come in and say, I think I need to get a new job. And I'm usually saying like, well, hold off before you go and quit your job. It's the same idea as people wanting to get sort of a fresh start. They think that if I start over somewhere new, all of these issues won't follow me. But of course they will.
Yeah, we saw that so much during COVID that people just thought, I mean, even in my own clinical practice, so many people just thought the change would make all their other problems go away. And really, it's so easy to make work be the easiest thing to change, right? When you're looking at your life. And I think more often than not, that's not always, it's just the Band-Aid, right? Okay. And I'll ask, so there's two more questions. I think the last question will actually tie in really nicely to just a quick little thing that we wanted to talk about around Circle Health. So I'll ask the first question right now, which is, how does the panel feel around the diagnosis and treatment of anxiety or depression using both counseling services and medication? Society seems to be using more and more drugs to make the pain go away. Do you want to start first, Rebecca?
Yeah, so I worked for a number of years for a team of psychiatrists. And so we obviously use pharmacotherapy, and I've seen a lot of successes with that, right? There actually isn't sort of a anxiety drug. There are drugs that alleviate certain sort of feelings. They're often for depression, but they found that they work for anxiety too. And there's just different, like there's different medications that they would prescribe for people with counseling. So the prescription is never just take this drug. It is always to be complemented by counseling. So I would say if you're seeing your physician and they're saying, oh, just take this one drug and all your problems will go away. Maybe you want to sort of, and you're not comfortable with that. Maybe that's sort of a red flag to maybe seek a second opinion around just taking the drug without the complement of therapy.
Yeah, I was going to say the same. I mean, as someone who's spent the entire part of my career dealing with, managing and advocating for integrated care, no one patient should be managed with just one route of therapy that isn't working. And so often than not, you really do want to ensure that you're getting that second opinion, not being afraid to ask your doctor for other alternative referrals to maybe a psychiatrist, a referral to more therapists and counselors, and really looking at your body as and your healthcare as a holistic view, so that you're really not just getting siloed into one type of treatment that isn't really helping you. So Michael, did you want to jump into the next slide, and then I'll ask this question because I feel like it ties really, really nicely into what we're going to talk about quickly over the next few minutes.
Absolutely, Dr. Sapna. I think it was a perfect one. So I've moved the slide over here to talk about Circle. And of course, I've got my questions for you specifically on Circle, but perhaps I'll just ask this question as a lead into that. And so one of our attendees asked, I understand employers have EAPs in place, but I find they don't cover my needs as a whole. And are there other options out there that companies can utilize?
Absolutely. And I really love what Rebecca spoke about earlier, just about, really making sure that as a workplace, if you're an employer visiting us today, that you're sending out more information about how to use your EAP. But she hit the nail that not enough of us use it preventatively. Not enough of us are using our healthcare resources, to really help us until we're trying to figure out our return to work plan, or when we are return to work and we're trying to, integrate back into that sort of situation. And, the reality is that a lot of EAP programs just don't have a great utilization or uptick. And a lot of the times being is that, people want to have, a one-on-one counseling experience that's really kind of also looking at their health as a whole. And so really Circle was born out of the concept of, really getting rid of a lot of the silos that most of us feel when it comes down to actual full service health and wellness. And so we're proud to spend a few minutes talking about Circle, which is actually a digitally enabled concierge that provides full service health and wellness care, both in person and virtually. And I think, again, some of the challenges of many of us now bringing our employees back into the workforce is recognizing that healthcare, I think one thing that we all struggled with, and I think we can all probably even put this in the chat if you agree, but we all struggled with access during COVID. And I think it's only getting worse. I think, being able to get access to your primary care provider, being able to get access to, even just the things that we feel should be simple, like prescription refills, being able to get your child quickly assessed if they have a cough or a runny nose and you're not sure if you should send them to school. There's a lot of these simple things that just drive people's anxiety up to an elevated level. And like Rebecca talked about, these are things that we just feel like we don't have control over. And so, Circle was really born out of really an elevated concept of what we already do as Integra Health, which is really, providing that integrated full service healthcare. And so when we look at Circle, we're really looking at the full picture of an employee's health and wellness, and using Thrive's amazing technology to really, integrate that in to provide great data-driven insights that's really going to help empower your organization, so that really when we talk about, the low utilization of EAP programs or the limitations of EAP programs, looking at how do we really make not just mental health services, but all types of holistic and allied health services in conjunction with medical services being accessible, being really, tailored towards one's actual health journey that's relevant to them. Because, EAP programs are great for certain situations, but they don't cover, sort of the day-to-day things that we might be dealing with, like Rebecca talked about. And sometimes we feel like we don't want to go that route with our employer when we don't maybe feel it's as pressing or acute or really, quote unquote, I'll say this with asterisk, serious, although they are affecting our productivity, they are affecting our day-to-day. So Michael, do you want to talk about a few of the key features?
Absolutely. And a great overview there, Dr. Sapna, and Thrive has had a wonderful time building the technology piece of this vision, really to bring it to life. And so finding that way and giving access for employers to provide a solution like this to their employees, really allowed us to use the cliche term, think outside the box in building a solution. And I think this goes back to one of the questions before too, when somebody sort of asked about that 9 to 5, 5-day-a-week workday. And Rebecca, spoke very well to that, of saying that doesn't work for every organization. And certainly that sort of aspect being built into the Circle offering with Integra, and be able to offer that 24/7 access to that in-person and virtual care for employees, is understanding that not every industry and not every organization is able to work 9 to 5 p.m. And so that's one of the sort of the great pieces of the technology, is that full-time access to healthcare. And then also it's in working with your clinical team and the clinical team at Thrive too, was building a lot of those wellness programs and those self-guided digital journeys, or by not even necessarily self-guided, because you certainly do it with your providers as well. Not every employee is the same. You can't, and not every patient or person's the same. You can't create one journey and say this works for everyone. And so having that abundance of journeys in there really makes a substantial difference. And then really that empowerment of providing that to the patients as well, of their ability to see the trends across their health as time progresses. Oftentimes we go visit our primary care physician. That's a stamp in time of that situation, or we're only doing it when we're sick and we're not seeing trends, and we're not seeing how things maybe getting worse, but hopefully are getting better in different situations as well. So it really gives us a lot more empowerment to manage our health there, in conjunction with a great health partner like Integra.
Fantastic. Yeah, and if there's no other questions, is there another slide after this, Michael?
Well, yeah, I guess I should. I'm controlling that. I need to click ahead, and now leads to my last question, which is, if anyone here wants to learn more about Circle, how they can get a hold of the team at Integra, or the team at Thrive, or the team at Circle.
Thank you so much. Yeah, and we want to thank everyone for attending. And I think what most of us kind of can take away from today's presentation is that everybody's feeling a sense of anxiety, a sense of, a little bit of elevated nerves as we enter into this fall season. We're hearing it on the news that, COVID cases are going up again, and everyone really is trying to mandate some form of return to work. And so we hope that you found today's presentation valuable and helpful. I definitely resonated with a lot of the things that Rebecca, spoke about, not only as a person, but also as an employer, and I think that we can all really sort of, resonate because mental health affects all of us, and our mental health affects our physical health. And I think one of the biggest things that we can do as, and excitedly through Circle, is that we are, allowing for more access to really great healthcare solutions that's going to make your employees' lives more conveniently, tailored around what we said again, not really being able to fit into that box of that 9 to 5, but really giving them tangible healthcare solutions that don't just touch on mental health and medical care, but also on other parts of your allied health, from physical care, nutritional care, and so much more. So as Michael mentioned, feel free to click the demo, to get in touch with us to learn more and to schedule a demo and to learn more information about Circle. And we thank all of you for staying on and learning with us and with Rebecca. And thank you all once again. And we hope to see you soon.
Take care, everyone.
Thank you. Bye, Rebecca.